Let's talk about screening and diagnosis of mental health conditions during pregnancy. So, mental health conditions, perimental health conditions include mental health conditions occurring in pregnancy or in the first 12 months after delivery, regardless whether onset occurred before pregnancy or during the perinatal period. So, major depressive disorders, we have to meet 5 out of 9 symptoms that are present during the first 2 week period. It represents a change from the previous functioning, and at least one of the symptoms is depressed mood or loss of interest or pleasure. So the symptoms include, let's see, so depressed mood most of the day, nearly every day, as indicated by either subjective report, such as feeling sad, empty, or hopeless, or observation made by others, appears tearful. Number 2 is marked diminished interest or pleasure in all or almost all activities. Number 3, significant weight loss when not dieting or weight gain. Usually it's more than 5% of body weight change in a month. Insomnia or hypersomnia nearly every day. Number 5, psychomotor agitation or retardation nearly every day, observable by others. Number 6, fatigue or loss of energy nearly every day. Number 7, feelings of worthlessness or excessive or inappropriate guilt nearly every day. Number 8, diminished ability to think or concentrate or indecisiveness nearly every day. Recurrent thoughts of death, recurrent suicidal ideation without a specific plan or a specific suicidal plan or suicidal attempt. So these symptoms cause clinical significant distress or impairment in social, occupational, or other important areas of functioning. And the episode is not attributed to psychological effects of substance or other medical conditions. So that was the symptoms. Then you have generalized anxiety disorder, excessive anxiety or worry occurring more than not for over 6 months about a number of events or activity, and also has other associated symptoms. So such as the associated with 3 of the 6 following symptoms: restlessness or feeling keyed up or on edge, being easily fatigued, difficulty concentrating or mind going blank, irritability, muscle tension, sleep disturbance. Obviously, it has to be affecting your daily function or causing clinical significant distress. So that was generalized anxiety disorder, and then bipolar disorder is broken up into bipolar 1 and bipolar 2. Bipolar 1 has to meet criteria for manic episode, which is a distinctive period of abnormal or persistent elevated, expansive, irritable mood and increased activity and energy for 1 week or more, are meeting 3 out of the 7 criteria. So these criteria are inflated self-esteem or grandiosity. Number 2, decreased need for sleep. Feel rested after only 3 hours of sleep. Wow, that's awesome. Number 3, more talkative than usual or pressure to keep talking. Number 4, flight of ideas or subjective experience that thoughts are racing. Number 5, distractibility, attention too easily drawn to unimportant or irrelevant external stimuli. Number 6, increase in goal-directed activity, either socially or at work or sexually, or psychomotor agitation, purposeless, non-goal-oriented activity. Number 7, excessive involvement in activities that have a high potential for painful consequences, engaging in unrestrained buying spree, sexual indiscretion, or foolish business investments. Obviously, it causes marked impairment in social or occupational functioning and or necessitates hospitalization to prevent harm to self or others. So that's a manic episode. So hypomanic episode is basically the same criteria, but this one only lasts 4 consecutive days. And then we have the major depressive episodes, which is exactly the same as major depressive disorder criteria. However, for bipolar 2, there is no manic episodes, but there is hypomanic episodes plus deep depressive episodes. Obviously, the bipolar 2 can be easily mistaken for unipolar depressive disorder and be treated wrongly, and this can lead to precipitation of manic episodes, mixed state, and rapid cycling or psychosis. Untreated bipolar disorder also increases the risk for postpartum psychosis and suicidality. And then we have postpartum psychosis, which can mostly occur 2 weeks postpartum. But can occur up to 1 year. You have hallucination, delusion, manic depressive or mixed state, feeling suspicious or fearful, restlessness or loss of inhibition, and odd behaviors. I think the most important is the hallucination and delusion, I think. So etiology, 1 out of the 5 patients can have some type of mental health disorder during pregnancy or postpartum. 80% of patients with perinatal depression have anxiety disorder, and 20% of the patients with perinatal anxiety disorder can have depression. Bipolar disorder affects around 5% of pregnancy. Relapse is very common during pregnancy, especially if untreated. These patients, 60% of these patients will relapse, versus if they're treated, only 20% will relapse during pregnancy. Postpartum psychosis can occur in 0.2% of all births. This does lead to 5 out of 100,000 infanticides. 50% would develop ongoing psych issues. Suicide and overdose account for 20% of pregnancy-related deaths. 3% of those screened for postpartum depression had self-harm ideation. Those who screened positive for depression, self-harm ideation is up to 30%. Pregnancy-related suicide is 4 out of 100,000 live births. 25% have self-harm prior to suicide. Risk factors for mental health: family or personal history of mental health, young age, veteran status, active duty member, unemployment, lack of support, incarceration, and insomnia. Prevention. So we have interpersonal therapy based on roles, reach out, stay strong, essentials for mothers and newborns. We have cognitive behavior therapy, the mothers and babies program. Patient with history of postpartum depression, we can start a prophylactic sertraline on postpartum day 1 up to week 20. This decreases the occurrence from 50% to 7%. History of bipolar disorder or postpartum psychosis. If not on medication during pregnancy, these patients should be started on medication postpartum. We can try to forego breastfeeding for sleep deprivation. Screening for depression and anxiety. Universal screening is recommended. For depression and anxiety, we can screen first visit, third trimester, and also postpartum. We use the EPDS screening questionnaire. This one screens for depression and anxiety. 10 to 14 is mild symptoms, 15 to 19 is moderate symptoms, 19 plus is severe symptoms, and also they're at increased risk for bipolar disorder. Question 3 to 5 is anxiety screen. If they score more than 5, they are considered positive for anxiety disorder screening. Screening for bipolar disease, 7% can have conversion from depressive disorder to bipolar disorder during pregnancy or postpartum. Screening once per pregnancy at first visit. We can use CD3 question, physician administered screening tool. Or we can screen these patients before we start them on pharmacotherapy for depression. 20% of depressive symptom patients will have bipolar disorder. Screening for postpartum psychosis. So self-harm screen positive requires further evaluation. We should ask about intent, plan, or the likelihood. We should distinguish between self-harm versus intent to cause death. 50% of mother died from suicide had intimate partner violence. Outpatient care and monitoring is appropriate if the suicidal ideation is infrequent. There is no intent to act, and patient is able to name reasons for not going forward with the attempt. We should rule out drug-induced psychosis. Short-term benzo or antipsychotic medication is first line for postpartum psychosis. Let's take a look at the. Let's see. I want to see the. Okay, so this is the CD bipolar screen. So we should ask the patient. Question 1. Some people have periods lasting several days or longer when they feel much more excited and full of energy than usual. Their minds go too fast, they talk a lot. They are very restless and unable to sit still, and sometimes they do things that are unusual for them, such as driving too fast or spending too much money. Have you ever had a period like this lasting several days or longer? Number 2, have you ever had a period lasting several days or longer when most of the time you were so irritable and grouchy that you started arguments and shouting at people or hitting people? If the answer is to either question, we'll screen for bipolar disorder with question number 3. People who have episodes like these often have changes in their thinking and behavior at the same time, like being more talkative, needing very little sleep, being very restless, going on a buying spree, and behaving in a way that they would normally think are inappropriate. Did you ever have any of these changes during the episodes? If the answer is yes to question 3, the screen suggests the patient may have bipolar disorder. Okay. I think that's it for screening and diagnosis.